Do you know that there are some people, they always have blood in their urine? It may not have happened to you, but it might have happened to other people. And this is the reason why we need to talk about it, because throughout this week, we've actually recorded about 3 persons that have always have that complaint of blood in urine. So we want to take this opportunity now to break it down for you. Watch it to the end. You will learn something today, and make sure you share it. When you say blood in urine, the word that we normally call it is hematuria. That is, it is the presence of blood in your urine. It can appear as pink color, as red color, as even Coca-Cola colored urine. So sometimes it is visible as clots, that you see it as a drop in your urine, or sometimes they have to use microscope before they can see it. This is what we refer to as hematuria. That's the blood in urine. Then, what are the causes? Because for you to see a blood in your urine, it is a dangerous sign. Oh. It is a dangerous sign. So, what are the causes? There are various causes of you to see blood in your urine. So, what are those causes? Number one, it can be as a result of UTI. If you have infection in your urinary tract, maybe from your kidney, from your ureter, from your bladder, or anything, you will have blood in your urine. So that is why it is not always advisable. You should leave infection for a long time before you treat them. Number two, kidney stone. Yes, it means your kidney is not functioning properly. By the time you start seeing blood in your urine, stones are already harming your kidney. That is why you see blood coming out. Number three, when you have kidney diseases, it could be infection, it could be inflammation, or anything. It can also result to that. Cancer is also part of it. Bladder cancer, kidney cancer, and all of that. It's also one of the causes of blood in urine. Then for men, enlarged prostate. If your prostate gland is enlarged, maybe due to sexual function issues, you see blood coming out from your urine. Then, and last thing, there are certain medications that can also result to that. If you are on medication, there are some drugs that will prescribe for you that it can actually result you to have some stains of blood in your urine. Then, how do you know if urine are present in your if blood are present in your urine? What are the symptoms and what are the signs to watch for when you start having these symptoms of blood in your urine? Number one is you start noticing pain and burning sensation when you are urinating. If you start having that, I mentioned earlier that okay, it's possible you might not see it through your physical eye as a blood clot or blood stain in your urine, except through microscope. So if you are having pain or burning sensation while you are urinating, that is a dangerous sign. Go to the hospital and talk to your doctor. Number two, if you are urinating frequently, every time you are urinating, it doesn't take an hour, you have gone to urinate. It's a sign, it's a symptom that you should also notice that. Then pain, abdominal pain. If you're having this serious pain, either from your back, from your lower back, that could be a sign of kidney issues. Don't take that for granted. Then if you're always running temperature, it's also another point, fever. So what do you now need to do when you start noticing this blood in your urine? What do you need to do? Number one thing that I will advise you to do is to stay calm. Yes, relax your mind immediately and seek medical attention. Don't panic, don't be anxious or anything. Go to your doctor. That is the first thing you should do. I didn't say you should go to Alagbo to get concussion and start taking. I didn't say you should go to roadside pharmacies, get drugs and start taking. That is the worst thing that majority of people used to do. The first thing is to stay calm and go and seek medical attention. Go to your doctor and explain to them what you have seen. Consult your healthcare professionals. You can either go to a general practitioner or go to a urologist. They will put you through on what to do. Then, two, provide details of medical histories and symptoms. Yeah, whatever symptoms you have, make sure you are free to them. Tell them everything. Don't shy away from them. You see, those people you are talking to, they are more sensible and more sensitive than you think. Yeah. So whenever you are in front of them and you want to talk, you might not be free, but I'm telling you that you should be free because they will help you to solve your problem. Then also make sure you undergo diagnostic tests. They will tell you to do various tests. They will tell you to do urine analysis. They ask you to do scan and all of that. Make sure you do them. These are what you should do immediately when you start noticing this. Then how do you prevent it, and how do you manage it when you start having this blood in urine, or you are having these symptoms that we've mentioned? How do you prevent it from occurring next? Number one is for you to always stay hydrated. Always take enough and sufficient water. Very, very important, because the more the blood is coming, the more you are urinating frequently, you need more fluid to go into your system. Number two, practice good hygiene. If you are always having sexual intercourse, make sure you go with protection. Practice good hygiene. Clean your private parts to be free from any infection. That is three. Then three, manage underlying condition. I've said infection, UTI, diabetes, hypertension, all of this. In fact, you see that some hypertensive patient can even be having this blood in urine. It is very, very dangerous to that extent. So get that too. Then, when do you now need to seek medical attention? Immediately. One, when you start having heavy bleeding, you see the bleeding is coming so much, run. When you start having severe pain, and when you start having difficulty to urinate, these are just three cardinal signs. When you start noticing them, early detection and treatment can significantly improve the outcome. So detect it early, talk to a doctor as early as possible, and the solution will be given to you. I still remain yours, Malik. Reproductive Health with Malik is our channel. Subscribe, like, and share our video. Tell us in the comment section what you need us to tell you more about it. Where are you watching us live from? Let us build a community where we share ideas and goals together.